We were 4 girls, aged 12 to 17.
We were isolated.
COVID disconnected us from our friends and family.
The 60s scoop and residential schools had separated us from our culture.
We found an Indigenous youth program online.
We made friends and found a community.
Our youth worker suggested we entered a competition for opioid strategies run by UBC.
We made the finals, but lost.
We didn't let that stop us, though.
We secured the grant funding and started to work on Talk Overdose.
We created videos, infographics, handmade merch, and presented virtually and in person.
It was hard to learn how to manage partnerships with adults.
It was scary to stand on stage and teach and manage workshops with participants much older than us.
But we persevered and found confidence.
We discovered youth like ourselves who wanted connection to their cultures.
We realized there was more we could be doing by creating educational programming.
We named our cultural education project Kishak, which means with a view to the future.
We created an organization, Y4Y Canada, to secure funding for both projects.
We try to change the world each day, little by little.
We are unstoppable.
Tansi, I'm Taliah. We were Team 3 from the 2021 Let's Talk Overdose case competition. We wanted to share what we've been up to with our Talk Overdose project for the past year. So as you can see, we've been delivering presentations and workshops to schools and to community organizations to reduce stigma surrounding opioid use. We created a grassroots organization called Youth for Youth Canada so that we can continue to create and manage projects that improve the lives of youth in Canada through arts, culture, and health education. 2 of our current projects are Talk Overdose, which focuses on health education, and Kishak, which focuses on cultural connection. Our projects are youth-led, so youth help youth through peer education, peer support, and peer-to-peer cultural teachings. The pandemic has impacted the well-being of youth everywhere, and we need to do our part and act now if we hope to make a difference.
Tansi, I'm Zara. Through the Talk Overdose project, we are trying to reduce the stigma surrounding opioid use by creating a series of videos of guest speakers with lived experience, by delivering workshops, and by making school presentations to students in grades 7 to 12, because that is the age when youth first start experimenting with drugs. By placing youth and people with lived experience at the center of substance use education, we are hoping to humanize the opioid crisis, provide students with tools to help themselves and others, address harmful stereotypes, dispel myths, and reduce stigmatization. We also make custom Indigenous chocolates and crates from recycled wood to share at presentations.
Tansi, I'm Sarina. I'm the youngest member of Y4Y. We owe a huge thank you to our mentor, chocolatier Pierrette Vézina, for teaching us how to make Indigenous chocolates. The chocolates have really helped to engage youth in actively participating at our presentations. Research has shown that there is a strong association between wellness and culture. Did you know that Indigenous youth and Indigenous communities in general are disproportionately affected by the opioid crisis? Through the Kishak cultural workshops, we are helping Indigenous youth ages 8 to 18 to help build a stronger sense of community. Kishak cultural workshops wants to bring together Indigenous youth and to help them heal through culture.
Quay, I'm Ayla. We need your help to get Talk Overdose into schools across Canada. Studies from 2022 have found that Canadian youth experienced mental health disorders in record numbers during COVID, and that over 50% of these youth have turned to drugs to cope. The opioid crisis isn't going away, and with there being a strong association between youth mental health and drug use, we need to raise awareness now. You can help us reach more youth by following us on our social media page, booking our virtual workshop, requesting a presentation at your child's school, which will also be virtual, and if you have lived experience, be a guest speaker, and help us apply for grants.